from the station that's on your side. This is Channel 7 News Daybreak.
Welcome back into Channel 7 Daybreak. Today is Wellness Wednesday, and joining us this morning is Dr. John Allen Cockerell from Baptist Health. And today, Dr. Cockerell, talking about something that maybe our audience isn't too familiar with, but it's something that does affect a large portion of the population, and it's something I know you want to make aware for the rest of us, hypothyroidism, and explaining what that is, how it can affect somebody. Thanks again for joining us. And what is hypothyroidism?
Sure. So hypothyroidism is an underfunctioning of the thyroid gland. It's a butterfly-shaped organ, the thyroid is, in the neck, right? Under control, actually, from the brain, from the pituitary gland in the brain down to the thyroid. It affects a host of functions in the body. We'll get into those. It is an increasing disease. It's increasing in terms of prevalence because we are screening more people for it. We're more aware of it now. It does carry significant factors that potentially, and it's good to know about. If it seems to fit you, definitely talk with your doctor about it.
Well, if people are experiencing the symptoms of it, what should they be looking out for so they can ask their doctor questions about it and how to move forward?
Sure. It vast. I mean, far-reaching. So not all things I'm going to mention are thyroid, right? Which is key to it, remind as well. But you're looking at things, as far different as joint pain to fatigue, right? Palpitations, chest pain, shortness of breath, muscle change, memory change, mood change. There's quite a bit with mental and physical health that the thyroid function, and specifically underfunctioning with hypothyroidism, can affect.
You mention all the symptoms, people might start thinking that's like a WebMD search, right? Where you type in the symptom and all these things come up and you freak out. But let's talk about exactly who this might affect, and also when it comes down to it, like what are the causes of it? How does something like this just happen?
Right. So the list, and that's a short list of symptoms, you're right. So there's a laundry list of symptoms. If it's any solace, right, it may not be that. So there are ways to screen for it, right? And I will answer your question, but in terms of screening to see who has this, there are labs your doctor can run to see if this is you, right? If those symptoms, if that list of symptoms does fit you, right? So there are ways to check this to help out. It does tend to affect women more than men. Older than the age of 60 is a risk factor. Also, previous surgery or neck radiation is a risk factor. All of those things, plus some others, including family history, genetics, could be a factor here as well.
And finally, treatment options. What's available to someone experiencing this?
Right. So the good news is with thyroid, it is a treatable condition. We often use supplemental synthroid-like hormones to essentially play the role of thyroid hormone when it's under functioning. So we help support your thyroid, support your body function better. It is medication-based. There are some alternative therapies to consider as well. But by far and away, it is a treatable condition, which is the good news, typically used with medications.
All right. Dr. John Allen Cockerell joining us on Wellness Wednesday. Thanks for explaining all that to us. And if you'd like to contact Dr. Cockerell or any of the fine folks over at Baptist Health to keep on amazing, you can contact them at the information on your screen. And Dr. Cockerell, we'll talk with you next time. Have a good one. Thank you again.